Hello, we are MAD Inc., which stands for Maternal Medicine Advancements and Development. My name is Andrew Fry, and my partners are Anna Karen Romero Lozano and Cole Barnett.
Our team spent some time in the maternal and fetal medicine clinic, learning and observing the entire patient care process. We shadowed clinicians, sonographers, residents, and fellows at the maternal and fetal medicine clinic at the Medical Park Tower in Austin. And we learned about all the different types of ultrasound scans and screening tests that is usually done for pregnant women coming in for routine tests. We definitely saw a need to improve access to fetal well-being for remote monitoring due to the fact that we saw patients traveling multiple hours to get into the clinic, as well as spend a long time just waiting for the workflow of the whole process to work out. We also saw people coming in with their partners or families, and everyone had to take the day off work. So we definitely saw a need to do this remotely, especially considering that the tests themselves were not very complicated.
So after making these clinical observations, we saw that there was a definite need to improve access to fetal well-being monitoring for pregnant patients to increase the quality of life for these patients. And this is because coming into the clinic for routine fetal health assessments can be inconvenient, taxing, and even impossible for many pregnant patients and their families. Remote screenings would not only be convenient and cost-effective for both patients and healthcare providers, but would increase the compliance for critical routine surveillance and improve the quality of life for pregnant patients and their families. In terms of telemedicine, its use in the field of maternal-fetal medicine has greatly increased since the onset of the COVID-19 pandemic, but the use of at-home monitoring technologies is still rare and expensive. Living in rural areas has been correlated with lower access to healthcare and shown to provide worsened health outcomes throughout the United States. And the use of telemedicine in the field of maternal-fetal medicine can improve many of these outcomes and is very cost-saving for both rural and urban populations. Over 3.6 million births took place in 2021 alone, and 20% of the US population lives in rural areas, showing that this need is not only one of convenience but also great significance.